Henry Smith.
Madam Deputy Speaker, thank you very much indeed, and it's a pleasure to follow the Honourable Lady from East Kilbride. This is indeed a very important debate, and I'm glad that we have had the opportunity to re-emphasise this government's commitment to the National Health Service, not least through record amounts of investment, 33.9 billion going in between now and additionally going in between now and 2024, but also the emphasis on having mental health on a par. And I was delighted recently that schools in my constituency are part of a pilot of having mental health professionals in schools to be able to help particularly those young and adolescent pupils dealing with those sorts of issues. I'm also glad that we heard earlier on my right honourable friend, the Secretary of State for Health, reconfirm, and this cannot be emphasised enough, that post-Brexit, when it comes to those international trade deals, the NHS is off the negotiating table. It remains free at the point of use, regardless of the ability to pay. I'd also like to take this opportunity, Madam Deputy Speaker, to re-emphasise that the record of this government is a good one on the NHS and hasn't always been, sadly, under previous Labour governments. In my constituency, last decade, we saw accident and emergency and maternity units be closed at Crawley Hospital in my constituency. Services have now been returning since, with a 24/7 urgent treatment centre that is opened, a new ward and new beds, and services also returning to primary care as well. But it does need to be stated that mention was made of the NHS being a political football, that all parties in this House can do better to improve on supporting our health service. One thing that I was pleased to raise with my right honourable friend, the Prime Minister, on his first full day in office in this place, was to seek a commitment for better support for primary care. One of the areas of challenge in my constituency is that some GP practices are at or even over capacity. A number of reasons: increasing housing, some doctors retiring early, a number of factors like that. But it is an area we need to address, particularly as more and more services are provided in GP surgeries such as scans and minor surgery, which is better for the patient experience as well. I'd like to mention just a couple of all-party parliamentary groups. I am standing down as the chair of the all-party parliamentary group on health and circulatory disease, but I'm very glad that earlier this year we were able to publish a report on artificial intelligence in the healthcare sector. That is very crucial, and I know that the Department of Health take that very seriously, and I was delighted that the Health Secretary could be at our launch, as I say, earlier this year. I'm also the chair of, just reappointed, I'm pleased to say, Madam Deputy Speaker, chair of the all-party parliamentary group on blood cancer. I very much support in the government's long-term plan for the NHS a commitment that 1 and 2 stage cancers will be diagnosed, 75% of them will be diagnosed by 2028. But blood cancer is different from solid tumour cancers and is much more difficult to detect. So I would put in a plea and a bid for blood cancer to be considered. Also on diagnoses as well. Blood cancer is the country's 5th most common and 3rd biggest cancer killer in the UK. But because of the vagary of symptoms, is often very difficult to detect in GP surgeries, and indeed, still some 28% of people first get diagnosed with a blood cancer when they are when they present at an accident and emergency, and that's something that needs an awful lot more focus. Finally, in the brief time I have remaining, I would like to touch on the importance of developing policy on child social care. Regrettably, West Sussex County Council, which covers my constituency on child social care, has been judged very poorly in this area, and a lot of remedial work needs to be done. This is an area, as with adult social care, that does need urgent addressing. It is often the poor relation to healthcare, so I think it's very important in this debate that as we talk about the NHS, we also make emphasis on the importance of better supporting social care as well. I would urge the House to reject the amendment because I don't want to see, as the Health Secretary said earlier on, nationalisation of, for example, the production of medicines. In the context of blood cancer, that would mean innovative CAR T cell therapy wouldn't be available.
In Farron.